Hello, hello. We are live. So welcome to this constipation webinar. I am Dr. Randi, and I thank you for joining me for this webinar called Why Can't My Kid Poop? About, of course, kids and constipation. So, I am a pediatric, family, and prenatal chiropractor here in Exeter, New Hampshire. My husband, Dr. Mark, and I own Steiner Family Chiropractic. And as a pediatric chiropractor, I see kids with a variety of health challenges. And I also see a lot of kids whose mom or dad brings them in because they just want them to be healthy and know innately that chiropractic can allow children to develop and thrive and be vibrant. So we see the whole gamut of kids, and as a pediatric chiropractor, I am passionate about sharing this information with parents about why a kid would even need a chiropractor in the first place. So chiropractic is about a lot more than just a bone out of place or a pinched nerve, but we will get further into that later. So why am I doing a webinar on constipation? There are far too many kids struggling with this today. It is one of the most common, if not the most common thing that I see in practice, and whether that's a kid coming in that their sole purpose for coming to the office is for constipation, or whether it's on their form, it's just a concurrent thing that the parents are kind of like, well, I didn't know that chiropractic could help with that. I didn't even know if I should put it. A lot of the kids that are coming in are struggling with constipation, and I do not like it. I do not like how many are struggling with this. And so the biggest thing that really occurs, and yes, of course, we know not being able to poop is not good for us. But even bigger than that, it's the life effect for these kids. You know, it's interfering with family dynamics. It's always, when was the last time they went? How much was it? What did it look like? Too many details. It consumes families today. It affects their school and learning. It affects their sleep and eating because, of course, their bellies are full, and so they don't want to put anything more in their bellies. It affects their friends and social activities. It's just not fun to be constipated. And then it's become a big event in a lot of households, as far as if you've tried things like suppositories or enemas, it can be a really big event, traumatizing for the whole family with screaming and crying and things like that. Some of the stories I've heard traumatize me, so I understand that it can be extremely just stressful on a family, and especially on that kid. And then, of course, when you're not pooping, you're not the same person. So these kids' behavior just go right, totally poor behavior, just not acting like themselves, extremely more angry and defiant and just uncomfortable. And so it wreaks havoc on every part of life. And I want to say, and I will continue saying on this webinar, that this is not normal. This is not normal. And so tonight what I want to do is bring some awareness to, the fact of what may be causing this constipation and why it's so widespread today. What I'm going to be talking about, you've probably never heard before. So I hope that you're having an open mind and an open heart to hear what I have to say. Some people may, kind of get angry and say, well, why haven't I heard this before? I've been to X number of doctors and nobody's ever said anything like this before. I just want you to have an open mind. And then also, you may ask how I can speak with such certainty about constipation in kids. And that's because I am affectionately becoming known as the poop doctor here in the Exeter community, and I love it. I wear it like a badge of honor. I am gifted a lot of things in the shape of poop, poop emojis all over the office, and I love it, but really I don't, because that means that there's enough kids that are struggling with this that they come to me and need to have help with this. And again, this is just not normal. And so we need to be doing something different. I want to give you some answers. Again, why this is happening with your kids. And I want you to have better answers, because the question of why is always being asked. And I'm going to be sharing from my experience with the kids that I serve on a daily basis with, not being able to poop. And then we may get a little bit sciencey, we may get a little bit nerdy just for a couple of minutes, but I know that none of it is ever going to go over your heads, mom or dad, that has a kid at home with constipation, because you've done your research. You've Googled this, WebMD'd, you try to find every answer that you could, and rightfully so. You want to help your kid in any way that you could. So I know that that I won't be talking above any of you. And then, of course, I'm going to give you some action steps. What can you do today to help your kid? So I want to first of all say that nothing I am going to say tonight is meant to bash any of the decisions that you have made for your kids. I trust, even though I may not know you, I trust that you are making the absolute best decisions that you can with your children's best interest in mind. I know that. You're a parent, and that's just what you guys do. And I'm also just not trying to bash any profession or any other line of getting help here, but this is just, as from my experience, what we are going to be talking about tonight. And by the time that parents have come to me with a kid that's struggling with constipation, they've tried everything. And I mean everything. You name it, they've tried it. Nutrition, diet, supplements, medications like Miralax, suppositories and enemas and all of that. They've tried everything. So they've been there. And 90-ish% of the parents that come to me don't want to be doing all of that, especially when it comes to the medication. It just doesn't make sense to them that they would have to give their child a medication for their body to do something that it naturally should. And we are very grateful that those things exist, absolutely, because like I said earlier, it's not healthy not to poop, so sometimes it does just need to get out of there. But I'm talking prolonged, continued use. A lot of parents are kind of saying, this just doesn't seem right. And today it seems as though constipation is being treated as, a single cause, a single solution, and that's just not been my experience. That's not what science says is going on with these kids. No two kids are exactly alike, so why would we be giving the same exact solution to all of these kids? Each child is unique, and we need to be treating each child as unique. And as chiropractors, we look through different lenses, and so I won't be talking about nutrition tonight. I'm not going to be telling you what your child should or shouldn't be eating. And the reason I'm not going to do that, I have a lot of information on that, but so do you guys. You have done your research, and you can go online and you can find a lot of those answers, and it's been my experience that that's just not the missing piece as far as what is really causing and can have a really great change for these kids that are struggling with constipation. So I know, and I will argue with you, that it plays an extremely important role. That is not what I'm saying that it doesn't. It does. However, with what we're going to be talking about tonight, if this is present, then it's just going to make that kind of less effective. And so the two together, what we're going to be talking about tonight, is just going to make it a lasting solution for your kid. So it's easy to miss something that you're not looking for. So when you go to any kind of provider and you say, you're struggling with constipation, my kid is struggling with constipation, they're going to look at one or two systems within the body. So maybe the digestive system, the elimination system. So they treat that as, that is just it, right? But I am going to ask you, what controls the digestive system? And when I ask that question in the office, a lot of moms will tell me, well, yeah, the brain. Yes, the brain. But how does the brain communicate with the digestive system? And that is through the nervous system. And as a pediatric chiropractor, I am honestly a nervous system doctor. So within our nervous system, we have a part called the autonomic, which, as the name implies, is the automatic nervous system. So it is the part of our nervous system that controls things that we don't have to think about. It's just automatic. So you're not having to think about your heart beating or your lungs breathing or your liver detoxifying right now. That is being controlled by your automatic nervous system. And within that system, we have two parts that ideally should be in balance with one another. One part is called the fight or flight. You may have heard that before. It's the sympathetic nervous system, And that is our natural stress response. So if, and this may hit close to home because last week we were having some bear sightings in our backyard here in New Hampshire. So let's imagine for a minute that if you walked outside and you saw a bear, what you are going to do is your body is going to do everything it can to run as fast as possible in the opposite direction. And when you do that, I'm going to ask you, do you think that your brain is concerned about telling your digestive system to continue digesting your lunch? Or think about pooping, getting rid of your lunch? No. Your body is doing everything that it can just to run as fast and far away from that bear as possible. Your senses are all magnified and you are there stressed, running as fast as you can. But then, once you're safe and away from the bear, then you can relax and be calm. And then your brain can talk to your body and say, okay, now is the time to digest. Now is the time. Yeah, you do have to have a bowel movement. That part of the nervous system is called the parasympathetic, or the growth and development part of our nervous system. And so what can happen is that when we experience stress, we want that fight or flight sympathetic nervous system to turn on. We like that. We want to be saved from that bear chasing us. But then ideally, when that stress is gone, we should be able then to transition easily back into that growth and development part of our nervous system. But what happens is when we experience a lot of stress, and I'll talk about the 3 different types of stress that can cause this to happen, but we kind of get stuck in that stress response. So we imagine like everything coming at us is a bear. Now, I hope a bear is never chasing you ever. But it's as if those are the messages that are going to your brain. So what are the types of stress that can cause this? Because we're talking about kids here. What kind of stress do kids experience, right? Well, when I sit down with a mom and go through a case history for a child, no matter the age, I always go back to when that mom was pregnant with them. Because that is, the mom's neurology when she's pregnant with you is when that is your neurology as you're developing in your mom's womb. And so if there's a lot of emotional stress during pregnancy, unfortunately, pregnancy is kind of fear-based today, and it's always, making you concerned about what's going wrong, and there's a lot of emotional stress. There can also be physical stress. So there can be in utero constraint that causes that physical stress on the developing baby. And then there can be chemical toxins that can chemically stress the developing baby as well. So those are the 3 types of stress that I'm going to talk about: the physical, the chemical, and the emotional. So we go through and went the pregnancy, and then we go through the birth. And today, the birth process, it is very physical in nature, whether it's a natural vaginal birth or whether it is a C-section delivery. There's a lot of pulling and a lot of twisting, particularly up in this upper neck and on the head. And what we know as chiropractors is that puts a lot of strain and stress on that upper neck and on that brain stem here, how that brain communicates with the nervous system, and that can cause a lot of stress and cause injury. And then, think about it. We're developing nice and calm in mom's belly, and then we're born, and maybe we're born in a hospital, and so and maybe there was an induction occurring, so we're going out faster than we thought that we would be, and then all of a sudden there are these bright lights and there's noise and it's scary. That's stressful for baby. And so all of that kind of gets locked up inside of their nervous system. And then maybe they were having NICU stays, which can be extremely stressful, and as I said, that intervention at birth, whether that's C-section, which we're so grateful for, but that puts a lot of stress and strain on that baby's neck, whether that's vacuum or forceps. And the most brain development occurs in the first 2.5 years of life. So if we had, one or all of these things occurring during mom's pregnancy, during the birth, then it's really no wonder that a lot of these kids that are coming in struggling with things like constipation, when you go back you realize, oh, they were a really colicky baby. They could never get comfortable. They did have trouble breastfeeding. They did have really poor sleep and just never seemed like they could calm down. They had frequent ear infections, and they had to be on multiple rounds of antibiotics, and they did have reflux. And then, oh yeah, my 7-year-old, if I think back to it, when they were babies, they had constipation as well. And so a lot of these things are thought to be normal, and they're not. They're just common. It doesn't mean that they're normal. Babies are supposed to sleep, eat, and poop well. That is what they're supposed to do. If they can't, then something is not right. And we're often told that they're going to grow out of it. And what we know as chiropractors is that they don't just grow out of it, they grow into other challenges. And so when we have a lot of this stress, and if you had a colicky baby, that's a stressed baby. If you have a baby that can't poop, that's a stressed baby. And so it may look different than the stress that an adult experiences, but it still gets locked in that nervous system and allows the body to not be able to heal, adapt, or regulate itself the way that it should naturally. And so what we chiropractors call that stress that's been stuck in that system is subluxation. Now, you don't have to repeat that word back to me. You don't have to remember that word, but just remember that when we say subluxation, we're just talking about that stress that's been stuck on that system. And so if we have too many of those stresses coming together, it just makes it so that the body can't do what it should. And remember that automatic or autonomic nervous system is in control of things like passing a bowel movement, because you're not having to think, oh, now is the time to go poop. Your body just knows naturally when it should. But if we have a lot of that stress, it just gets stuck in there and just doesn't work the way that it should. Like that, metaphorically, that bear chasing after you all of the time. Every event is a stressful event. And so what are we going to do about it? We as chiropractors do not just realign crooked bones and unpinched pinched nerves as miscommonly perceived. We don't just relieve those tight muscles and do that. We find that sympathetic stress that's been stuck on in your child's nervous system and stimulate that other side of the nervous system that I talked about, that growth and development, that healing part of our nervous system. So with our super gentle and super specific chiropractic adjustments, we can stimulate that growth and development, allow your child to be more calm and more connected. And when this happens, things like constipation then allow those just go away, because we're allowing the body to do what it should, be able to digest the food and get rid of it. And so the adjustments allow your child's body to heal and adapt. And it's almost like we're unwinding that stress from the nervous system. And it really doesn't take much. When adjusting kids and babies, a lot of times they sleep through the whole adjustment. And a lot of times too, that especially with the little babies, when they've been constipated for a really long time, adjustments can stimulate that. It's an immediate thing. A lot of times they fill up their diapers right on the table, and it's my favorite thing. It's so magical. So I love being able to help these kids, and I love being able to help the parents kind of provide them relief, because when their child starts pooping again, then everything gets better in the house with their friends. Everything just gets better. Behavior improves, and I know that to be true. That's been my experience, that the life effect when these kids start pooping is even greater than knowing their body's just doing what it should naturally. It's just the quality of life that these kids are experiencing now that they don't have to worry about being constipated. And so, how am I going to know if I could help your kid? Because as I said before, every child is unique, and where that stress in one child has been locked up is going to be different in the next. So what I would need to do as a pediatric chiropractor is see where that stress is locked in your child's system, or if there even is any. And so to figure that out, we have some state-of-the-art nervous system scans right here in the office that uses infrared light that can literally tell me where that stress is, how long it's been stuck in there, and how severe it is. And with that information, I'd be able to know, A, if I can help your child, and B, what it's going to take to be able to get your child to where you want them to be. And so we often say we don't guess, we test, because we use these nervous system scans to really test exactly where the focus needs to be. And so imagine what your life would be like if your child wasn't constantly struggling with constipation. Imagine what that would be like, the quality of life. And it seems like such a small thing, but Mom, I know it's not a small thing. I hear you. I hear that it messes everything up. And when that goes away, it makes everything better. And so what I would recommend you to do, your action steps for tonight, is first of all, to never stop asking questions. You're watching this webinar because you were looking for answers, and I hope that I gave you some information that made you think and that you hadn't heard before and really resonated with you. But I would never ever want you to stop asking questions and stop searching for answers. But I would love the opportunity to get your child scanned, because that would be how I would know if I could even help you in the first place. And so what we would do is we would bring your child in to get those scans. Now, the first question I always get is, well, my kid doesn't like anybody, or they don't like going new places, so how are you going to get them to be still for a scan? And we get that question all of the time, and we understand that it is a dance. We have a lot of fun in the office, and we always make sure to get what we need done in the most comfortable and easygoing way. A lot of times, or some of the times, we can be chasing the kids around the office. We've had to chase kids around the building before, but a lot of times those kids that the parents are concerned about them not liking coming to the chiropractor, a lot of times after the first couple of adjustments, then they're running in and jumping on the table excited to get adjusted. So what we would do is we would do those scans, see exactly where that stress has been locked in their system. And then what I would do is study those scans and figure out how long it's been there, how severe it is, and what I can do about it. Then on your next visit, what we would do is go over all of that. I would tell you everything that I see on that scan. I would tell you how long it's going to take, and I'm going to tell you how much it's going to cost to get your child well. So if you are interested, I would love for you to contact the office, and I thank you for joining the webinar tonight. I hope that you learned something, and I hope that you will always be asking questions, and I would love the opportunity to scan your child to see if chiropractic may be that missing piece in your child's health journey.